If you're dealing with itching and pain from skin conditions like scrapes, minor irritations, or insect bites, or if you're experiencing nerve pain after shingles, Ztlido Adhesive Patch may be able to help. This medicated patch contains lidocaine, which is a type of drug that can temporarily numb the area where it's applied. This can provide relief from discomfort and itching. It's important to follow the recommended dosage and apply the patch at the optimal time for the best results. When using Ztlido Adhesive Patch, Medicated, it's important to follow the directions on the product package. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. The patch should only be applied to normal intact skin. Do not apply to skin that is broken or irritated. The dosage is based on your medical condition and response to treatment. Remove the protective liner and apply the patch to the skin area that is most painful. Apply the prescribed number of patches as directed by your doctor, usually once a day. Depending on your product, the patch may be left on the skin for up to 8 or 12 hours. Follow the instructions carefully. Do not apply more than 3 patches once a day or leave any patch on for longer than the stated time period. If a smaller patch is needed, it may be cut with scissors before the liner is removed. It is best to avoid getting the patch wet, since it may not stick to the skin. Some brands may be wet in water for a short time, such as showering for 10 minutes. Pat dry gently if you get the patch wet. After each application, wash your hands well. Avoid getting this medication in your eyes or mucous membranes, such as nose or mouth. If contact with the eyes accidentally occurs, wash your eyes right away with water. If your condition does not improve, or if it gets worse, or if you think you may have a serious medical problem, seek medical help immediately. Used patches still contain some medication. However, do not reuse them. Fold the used patch with the sticky sides together and discard it out of the reach of children and pets to prevent accidental swallowing or application. Some possible side effects of using the Ztlido Adhesive Patch, Medicated, may include redness, swelling, blisters, or changes in skin color at the site of application. These effects typically go away within a few minutes or hours. If any of these effects last or get worse, it's important to speak with your doctor or pharmacist promptly. If you experience irritation or a burning feeling, remove the patches and do not reapply until the irritation is gone. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Many people using this medication do not experience serious side effects. Be sure to inform your doctor right away if you experience any serious side effects, such as blurred vision, mental/mood changes, such as nervousness, confusion, drowsiness, dizziness, or an unusually slow heartbeat. Seek medical help immediately if you experience very serious side effects, including pale/bluish/gray skin, unusual tiredness, shortness of breath, or a fast heartbeat. While a very serious allergic reaction to this drug is rare, it's important to seek medical help right away if you notice any symptoms of a serious allergic reaction, such as a rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed above, it's best to contact your doctor or pharmacist. Before using the Ztlido Adhesive Patch, Medicated, make sure to inform your doctor or pharmacist if you are allergic to lidocaine, other local anesthetics, or any other allergies. It's important to mention any medical history of liver disease or a certain blood disorder, methemoglobinemia. While wearing the patch, avoid exposing it to direct heat sources such as heating pads, electric blankets, heat lamps, saunas, hot tubs, heated waterbeds, or prolonged direct sunlight. Heat may cause more drug to be released into your body, increasing the chance of side effects. If you are going to have an MRI test, inform the testing personnel that you are using this patch. Some patches may contain metals that can cause serious burns during an MRI. Ask your doctor whether you will need to remove your patch before the test and apply a new patch afterward, and how to do so properly. During pregnancy, use this medication only when clearly needed and discuss the risks and benefits with your doctor. This medication passes into breast milk, so consult your doctor before breastfeeding. When using Ztlido Adhesive Patch, it is important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. It is essential to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. Before making any changes to your medication dosage, always seek your doctor's approval. This will help ensure the safe and effective use of Ztlido Adhesive Patch. If the Ztlido Adhesive Patch is chewed or swallowed, it can be harmful. If someone has overdosed on the medication, the patch should be removed if possible. If serious symptoms such as passing out or trouble breathing occur, it is important to call 911. Otherwise, a poison control center should be contacted right away. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canada residents can call a provincial poison control center. Symptoms of overdose may include severe drowsiness, seizures, slowed breathing, and a slow, fast, or irregular heartbeat. It is important to follow the recommended dosage and timing for this medication to avoid any potential risks. Make sure to keep all of your regular medical and lab appointments. This will help your healthcare provider monitor your progress and make any necessary adjustments to your treatment plan. It's important to follow their instructions carefully to get the most benefit from Ztlido Adhesive Patch. If you are using Ztlido Adhesive Patch on a regular schedule and accidentally miss a dose, it's important to use it as soon as you remember. However, if it's close to the time of your next dose, it's best to skip the missed dose and wait for the next one. It's not recommended to double the dose to make up for the missed one. Remember to always use it at the regular time and never take more than the recommended amount. When storing Ztlido Adhesive Patch, Medicated, make sure to keep it at room temperature and sealed in its protective envelope until you're ready to use it. Remember to keep all medications away from children and pets. It's important not to flush the patch down the toilet or pour it into a drain unless instructed to do so. Properly discard the patch when it's expired or no longer needed, following the instructions in the How to Use section. And that's it for storage and disposal tips for Ztlido Adhesive Patch, Medicated. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.